What's up, everyone? Dr. Eric Jackson here. Talking to you today. I think we're going to talk about the importance of baby teeth. So I often get questions specifically why this and why that about baby teeth, but every once in a while I'll get a very wide-ranging question, such as, do I even have to brush them? They're just going to fall out anyways. And the answer is, of course. The answer is yes. Why? Why do you have to keep these baby teeth clean if they're just going to fall out? Well, they're active, they're live, they have to be in there for sometimes about 12 years, give or take, depending on when they come. Most children will have all their teeth by the age of 3, have them erupt through. Most of the time, 12, 13 years old will be when you lose your last baby tooth, but all that is a very big variable. No child develops the same way, siblings develop differently. In my own office, my own practice here, I have several young ladies actually who have, I think they're about 15 or so, and they've got baby teeth that have not been exfoliated yet, they've not been lost yet, and the adult tooth is there. We took a little quick double check because that's kind of on the outer end of normal, but it's fine. It's just taken a long time, and in a way it's kind of nice because that adult tooth is completely sterile inside the gum and inside the bone. And once it pops out, it's susceptible to decay. So early erupting children have to be very good about their brushing right away. Most of the time at 6 months old. That's why we want to make sure we're using a good fluoride toothpaste. The fluoride guidelines have been updated as of 2014. I'll link to the, I'll put a little card up above, link to the video that addresses that. So we don't have to go into it here. But essentially, we need to have good, healthy baby teeth because speech is a big reason. Without teeth, whether you're an adult or you're a child, you really can't speak properly. Your phonetics are off. In addition, they reserve space for the permanent teeth. I always like to use the analogy, the baby teeth and the positioning of the baby teeth are kind of like a parking lot. In a child that has a very classic baby tooth smile with gapping in the front, lots of space, those parking spaces are more than those baby teeth need, and they'll be ample, odds are, for the adult teeth to come in. When the child has a very mature smile, maybe it's very photogenic, but all the baby teeth are together, there's no baby, there's no gapping in between them. It looks very adult-like. It photographs well. I'm sure it's very great, but ultimately, odds are that child's going to have some crowding at around 6, 7, 8, 9 when those teeth start poking through, and they're kind of on top of each other, aka the parking lot is not large enough to accommodate the larger vehicles that are coming in. So we want nice big parking spots for those adult teeth, and then we avoid problems that way. In general, we also have to be just aware that without taking care of your teeth, things can be painful. All these rules are pretty well established for adults or children. I don't have the statistics in front of me, but I know that they're out there. If you want to do a quick Google search, the number of days missed of school due to dental issues for children in America is a surprisingly high number. And it's something that we need to get down. We're really pushing hard. I know the different American Dental Association, the ADA, all the way down to the local regional type areas, down to the local offices. Our office really tries to push that fact. Don't miss school because of dental emergencies. If you can help it, prevention will help prevent all that heartache, pain, additional expense, and overall just make for a healthier individual. We have to have baby teeth that are stable for the entire duration of their need. In my office, we always are talking about overall health and cavities, of course, but also grinding and clenching. There are children out there and that will grind and clench their teeth, sometimes tremendously, and that's where we start getting into airway potential issues with the airway, and we bring in some ENT. I've got a couple pediatric ENTs that we work with because sometimes it's very good to get that outside medical opinion about why the young child is grinding. Pediatric obstructive sleep apnea is A, real thing, and B, a very serious thing. It affects behavior, it affects emotional status, it affects schoolwork, it affects learning, it affects pretty much everything. Imagine if you were always tired, if you had an adult apnea. Could you really do your job right? The answer is no. Usually adult apnea patients, especially the severe ones, are falling asleep at the job, worse yet, falling asleep at the wheel. These are the types of things that translate down to children too. Falling asleep in class, not being able to concentrate, perhaps acting out because they're so just gosh darn tired all the time. They're angry. We don't want any of that. And a lot of that comes down to how could you identify that? Well, behaviorally maybe, but also, and I'll tie it back together, it's the ground down teeth. The grinding of the teeth, the wear and the bruxism often goes hand in hand with that. Not always, but it's definitely worth talking about with your dentist, with your pediatrician, and possibly with the pediatric ENT. So in general, remember, you've got to keep, the child has to keep these teeth till about 12 years old. It's one of those things where if you can set the child up with great oral hygiene instructions and a history, if they can make it through their first 12 years with the baby teeth, and then make it through their second 12 years with all their adult teeth, if they can come out of college and be in their mid-20s with minimal or hypothetically even zero dental issues, they have a tremendous, that's 25 years of positive, they have a tremendous potential to go the next 75 years with minimal dental ups and downs. There's always going to be something here and there, and no one goes through life without some sort of dental issue like a cavity or whatnot. That's just statistically not possible. But with that said, setting them up for success is very important. So that's the final reason I'm going to tell you why baby teeth are important, because you're setting a child's behavior up for success. No different than when I speak to my children about it's important to do your homework and study and eat a balanced diet and exercise and do everything else, because hopefully they'll take some of that and translate it to adulthood, where frankly we all struggle working hard and eating a balanced diet and maintaining good physical fitness and sleeping right and etc. It's the same exact thing, but without teaching them when they're young how to do it and the reasons why, which is what children always miss. Maybe they know they have to brush their teeth, but they don't understand why. They don't understand why it has to be done day after day. One thing I talk about often is, gaining weight, right? If we all gain, 2 pounds a year, not the end of the world. 2 pounds is very small. 2 pounds, 3 pounds, nobody even bats an eye, right? But if you gain 2 pounds every year, all of a sudden 10 years later you're 20 pounds overweight or 30 pounds overweight, and that makes a big difference to your medical health, to your dental health. Hypothetically, it can bring on other medical ailments, diabetes being the one that I'm thinking of first, but it could be a lot of things. The same goes with dental care as a pediatric patient. If you don't brush your teeth properly as a kid, well, maybe you're okay for a little while, but all of a sudden you start seeing some issues a couple of years later, and then those issues, and then those fillings, and these fillings, and then yes, you get to have a brand new set of teeth at 12, but the behaviors have to be there. And so really try to stress that with your pediatric patients, with your children, if you're a parent and not in the dental field. But ultimately, these are the kinds of concepts that are very, I do talk when we give our parent lectures and whatnot locally. We talk for hours about this. So please let me know what you'd like me to talk about more. I can make videos about each of these topics, any of the topics, and anything in between. Thank you very much for your time. If you like the video, please give it a thumbs up. Follow that link, like I mentioned, the card earlier. I'll put some nice links to it in the description as well. If you like the channel content, please subscribe. At the end, push the button, and there'll be 2 videos if you like. Take a look at those as well. Comment anything you'd like me to write about or like to speak about earlier. Write them in the comments. And most importantly, have a great rest of your day. Thanks for watching. I'll talk to you soon. Bye-bye now.